wrap up today, we've got a few more things to do. We've got one more presentation for you, and I alluded to this at the beginning. The Health Science Education graduate program has been around for, I think, a dozen years now. And we're very happy to be at this place where we started to recognize our graduates, the graduates of our program, moving on into new things, new initiatives, and to become real leaders in the health professions education scholarship world. So for the last couple of years, we've been really honored to be able to welcome alumnus back to the Education Research Day. So we can show them off. That's the most important thing. It's about me, mostly, and us. No, but also so that they can share their work with you and their stories with you in a manner that's inspiring and informative. So I'm very grateful to welcome Dr. Marco Zaccagnini back to McMaster University to talk to us today. Marco is currently a Banting postdoctoral fellow at the University of Ottawa and an embedded clinician-scientist with the Canadian Society of Respiratory Therapists. And I know he's got some other things coming up, but we won't talk about those right now. Marco's going to land somewhere else pretty soon. So his current research centers on the scholarly roles of respiratory therapists and strategies to strengthen evidence-informed practice through integrated knowledge translation principles. So we wanted to welcome Marco today as a capstone to the conversation we had this morning with our panel about epistemic communities and interprofessional practice, because it was a nice dovetailing with his own research. So I'm not going to take any more of your time, Marco.
Thanks.
I'm going to pass it on to you.
Thanks a lot. I think everybody could hear me. So really, thank you for the invitation back. I remember my time quite fondly at McMaster, and really I've only progressed in my PhD program, so thank you for the invitation and the guidance. So as Lawrence had mentioned, I think Mac has had so many cohorts over the last few years, and I think it's really interesting that I was invited back, and I look forward to seeing how other graduates are influencing the clinical sphere, the research sphere, and the world in general, really. So I'll be talking a little bit about my research and try to anchor some of the conversations of interprofessional education and epistemic communities. So I think it is really important to start off with just the story of why I applied to the HSED program. But first and foremost, I did not want to be an educator whatsoever. It was not something that interested me, even though I applied to education, so that's fine. But what I felt that I had to do is I felt that I had something to prove. So Lawrence had mentioned that I am an embedded clinician-scientist at the Canadian Society of Respiratory Therapists, so I am a respiratory therapist practicing clinically right now. And I had often sensed that my contributions in the healthcare teams were undervalued. We were often seen as technical support rather than clinical knowledge holders. And I had originally believed that this stemmed from how our profession was perceived, more so a technical, diploma-based profession, and was tended to be excluded from these academic decision-making spaces. So those feelings of being undervalued and the great education that I got from McMaster had eventually pushed me to ask deeper questions about my profession and health professional education in general. So considering that my profession, respiratory therapy, has a deeply technical history, stemmed from being subordinate to physicians back in the 60s, helping them apply mechanical ventilation and devices on patients, compared to today where they are invited as members of an interprofessional team and work in multiple areas of care from primary to critical care in all age groups. So then why has our practice evolved dramatically, but the structures that surround them, things like education, scholarship, research, regulation, and recognition, have not kept up the pace with involvement? And my interest is about scholarship and scholarly practice and knowledge and research. So because these structures haven't evolved, RTs and many others tend to have a very different relationship with scholarship, one that is more practice-based, one that is, I guess, a bit more informal, and by virtue of that, unrecognized and undervalued. So anecdotally, other RTs and other professions on the professional team had often described that they would feel like second-class citizens within these interprofessional teams. that their knowledge is questioned or at worst ignored. They describe themselves as being invisible and not considered. So if I were to borrow from Dr. Thomas's talk this morning, you could describe this as a sense of epistemic injustice. Your knowledge is discredited because of your capacity as either a person, a professional, or what profession you represent. And Mac was amazing at showing me the breadth of literature in medical education, in health professions education, where there's quite a bit of literature about injustices at the patient and the professional dyad, and belonging colleagues have a couple papers about that include examples between a physician learner and a physician teacher, but much less has been written about this in a professional lens. So in my PhD work, I anchored some of these feelings of undervalue to the competency framework in RT, and specifically to the competency of being a scholar or scholarly practice in any one profession, whether it's MERIT or HSED. And it's competency that is foundational in many health professions, but absent in the respiratory therapy competency framework. And this has an implication and a message to how knowledge is valued, which then became the central focus of my doctoral research. What is scholarly practice, and what happens when a profession doesn't formally recognize it? So, when in speaking to professionals throughout my PhD, so this is just an example of qualitative pieces that I had done. RTs have often felt very peripheral to healthcare conversations, not because necessarily they lack the skills in it, but because they feel excluded from epistemic communities. They don't see themselves as these scholarly individuals. And when individuals don't see themselves as these scholarly individuals, they're less likely to advocate for change, to question the norms, or feel empowered in these interprofessional teams to make a change or to say anything, which then undermines how they perform in those teams, and actually they don't bring their expertise, they don't contribute to that team. So scholarly practice essentially became a proxy for something deeper, something about identity, legitimacy, and a marker of professional worth. And my dissertation was essentially a multi-method format, not a mixed methods, no hate. But it was a multi-method format, and we asked these. We had asked these questions then in a cross-sectional study across the arts profession across Canada, and we asked them about questions about their scholarly activities, the identity factors that influence it, with 832 responses across Canada. So the results were very similar, right? They were not engaging. They were not engaging in writing papers. They were not even engaging in reading papers. They were not presenting knowledge, either locally in their institution or provincially or nationally. They weren't driving their own learning essentially, but asking questions about what they desired. Well, they really wanted to be in a supportive working environment. They really wanted to participate in these scholarly activities, gain the skills, and need mentorship to do it. And interestingly, we asked these questions in an open-ended in the same survey about the benefits and the challenges of being a scholarly practitioner. Well, the benefit is being a respected and recognized professional, but the most challenging thing is limited recognition of respect. So clearly there's sort of self-fulfilling prophecy here. So while the world is on fire and everything terrible is happening right now, why should we study scholarly practice, or why does it even matter? Because it seems to connect to the heart of what it means to be a professional, right? It empowers individuals to engage with evidence, to help generate it, to engage with it in their day-to-day practice, and it contributes to legitimacy, autonomy, and confidence, especially within those professional teams. It's about epistemic justice, again, borrowing Dr. Thomas's talk this morning, ensuring that the individuals that have voice have a seat at the table and contribute to those healthcare knowledge. And it's scholarship and research, it is one way to be recognized. It is not the only way, but it is quite a powerful way. And some of this power comes from the sociological literature. In the sociological literature, there are many theorists and researchers that argue that professions maintain their place in the healthcare system and even in society by and large by engaging in these types of activities, research, scholarship, some of them call them abstract knowledge. They have to engage in shaping how it's produced, interpreted, and used in practice. And when clinicians are engaging in these research activities, they're presenting findings, they're critically appraising evidence, they're participating in the co-production of knowledge. It's not a means of just being academic. It is actually, they're engaging in a form of professional self-definition. They're asserting that their perspectives have value. But when we look at the sociological literature, this is really siloed according to profession, right? Physicians have their body of knowledge and they create the boundaries of their profession. Same thing with nursing, etc. But can you imagine now with these conversations that we've had today about abstract knowledge that is unique to an interprofessional team, right? And you know, I think you spoke about sort of those defending territories and those scopes of practice, but you're just reinforcing those silos. So it's almost important to start thinking of interprofessional as a unit rather than, or like its own type of profession, its own sort of profession that has its own unique body of knowledge. So scholarly practice essentially becomes a mechanism for identity and viability. So right now, despite what I learned in my PhD, we've talked and published papers, for 5 years, nothing has changed in my educational or professional landscape, or very little has changed. For RTs specifically, there's limited opportunities to engage in this scholarly engagement. RTs tend to finish their education with little emphasis on scholarship. And you combine all of these perceptions of feeling undervalued, you pile on these high trends of burnouts, no energy to become engaged, barriers to engaging in research, limited opportunities, and self-fulfilling prophecy of remaining undervalued. So what I'm exploring in my postdoctoral work are pedagogical strategies to mitigate some of these perceptions of feeling undervalued. So I'm developing micro-credentials, which here in Ontario, many people have probably heard about it, as a pedagogical strategy that support RTs in becoming evidence-informed practitioners. So without requiring them to become researchers, right? It's like almost trying to say, how do you teach research methods to an individual who hates research methods? Like, how do you go about that? So micro-credentials essentially are short, targeted training, and we are co-designing them with clinicians and are meant to fit into practice, but not sit on top of it. And the goal is to give them agency to feel confident, capable, and recognized to use and apply knowledge. And the entire postdoc is essentially grounded in an integrated knowledge translation and research co-production model, which is essentially defined as a collaborative approach that actively involves knowledge users in all phases of the research project. So it is time-consuming. It is much more effort. But by involving individuals from the beginning, by even from defining the research question to examining the findings and how we're going to disseminate this, the goal is to foster this co-creation and have an uptake in actual using and change. Going through this through 4 interrelated projects, so a knowledge synthesis of micro-credentials in health prevention education and needs assessment of BRTs, creating those micro-credentials using the learning design principles, and a mixed methods, a true mixed methods evaluation. And it seems like a lot in the postdoc, and it is a lot in the postdoc, but whatever, it was funded, and I'll land somewhere else after, so I'll finish the work, and that's the most important thing. I'll just take a moment and just actually talk about micro-credentials, just because Ontario is actually leading the way in pouring millions and millions of dollars into this new thing. And they're positioned as these unique interventions that can possibly offer a promising way to support professionals to upskill and be ready for the current practice. But we have to see carefully, right? They're marketed as these solutions to capacity and access issues, but they also carry the risk of disaggregating learning into these fragmented, contextualized skills, because you don't have to tell anybody in this room, but competency is not a single, it doesn't live in a single moment, it's not a single entity, right? It's an academic practice, it's refined, it's an academic team within systems. So as educators, I think when this new thing comes out, instead of saying, well, does this work, we have to start asking questions about, well, what kind of professional development ecosystem are we reinforcing with these tools, and what values and assumptions about knowledge are embedded in them. The goal is that by implementing them thoughtfully, co-designing them with those that will use them, grounded in a coherent vision of professional knowledge, and of course, pedagogical best practices, maybe support cultural shift. And what could that cultural shift look like or be? For me, it's stronger interprofessional presence, stronger interprofessional team, greater research update in day-to-day care decisions, empowering clinicians to lead quality improvement policy initiatives, but overall, equitable epistemic participation. So In a way, when I started my master's, it was a journey to prove myself. What I had found was that actually many others in my profession and across disciplines and other professions felt it felt the same way. And studying scholarly practice gave me language for something that was always there but not well articulated. And my work really centered on respiratory therapy, but I feel that the insights actually extend beyond any one profession. There are many professions in the periphery of sort of that traditional medical hierarchies that tend to feel the same exclusion. And at its heart, it's about reimagining how we value knowledge, right? Going back to Dr. Thomas's talk this morning. And it's especially valuing the knowledge, especially the kinds of knowledge that are lived, shared, and practiced every day in healthcare amongst its people and its patients and everybody's patients' proxies. It's about building a more just and inclusive epistemic space, one that recognizes expertise embedded in all corners of care. So I just want to thank everybody for listening to my journey, and what I look most forward to is seeing the students of the HSED grads and their journey in the years to come. Now I'm starting to get older. So thank you.
Thank you, Marco. I don't know.
Everyone's tired, I understand.
Everyone's tired. I think we've got to keep the ball rolling here to make sure folks can make school pickups and the like. But for those HSED students that are involved in the residency week period, you're going to get a lot of time with Marco tomorrow to pick his brain about these ideas. And thank you so much for taking us from the beginning of the day to this nice ending point, which really weaves through all of the presentations that you would have heard today, this idea about the value of scholarly practice in the education space from a lot of different professional lenses really resonates. So thanks so much. We're going to end the day with a few awards, and in particular we're leading up to our Health Professions Educator Award, which is a major award for the university. I'll pass it off to Jonathan to speak to that, but before I do, it's also a good opportunity for us to recognize and applaud some of the health science ed students that were recently recognized with awards also. So first of all, we have one CGSM, Canadian Graduate Scholarship recipient this coming year, Julia Halcroft. So a round of applause. Also, just recently at the Faculty of Health Sciences plenary, we had 3 health science education students recognized with the Outstanding Graduate Student Award. This is for excellence in academics and scholarship. 1 in each of our full-time thesis-based, full-time course-based, and part-time course-based streams. And they are, respectively, Charlotte McEwen, Gordon Burden, Julie Rose. Congratulations.
This is easily my favorite part of Nerd Day, besides being with all of my favorite nerds. It's an opportunity to recognize the sustained excellence of colleagues, and in this case, a friend to the education mission of our faculty. The Health Professions Educator Award for 2025 is Dr. Ruth Chen. I want to talk a little bit about the award and Dr. Chen, and I can give her an opportunity to offer us some words of encouragement. The Health Professions Educator Award is one that is recognizing senior faculty and leaders from their respective schools that have made substantial and sustained contributions to the Faculty of Health Sciences via education through means that include teaching, mentorship, innovation, and scholarship. Dr. Ruth Chen accomplishes all of this. Let me tell you a little bit about her story, recognizing there's so much more to hear. She began her academic career with a bachelor's degree in molecular and cell biology at Berkeley. She went on to do graduate training at Yale. She is certified as a clinical professional, as an advanced care practitioner, and as a nurse practitioner. And then she came here to McMaster to do a PhD in health research methodology. And we said, we can't let you go. Currently, Dr. Chen is the Associate Dean, Continuing Professional Development, and the Acting Director of McMaster Continuing Education. She's an Associate Professor in the School of Nursing. The ways that she's influenced over a sustained career, the education mission, are numerous. Let me capture just a few highlights. She has run a pathophysiology course for provincial primary healthcare nurse practitioner program. She teaches in both undergraduate and graduate programs within the School of Nursing, and has also been an instructor in the Health Sciences Education program. She has served on master's and PhD thesis committees, and has been an advisor to a number of course-based master students. She has a number of previous academic roles, as if she hasn't done enough, as the Assistant Dean, Academic Resources, the Department Education Coordinator for the School of Nursing, the Assistant Dean of Faculty Development, and so much more. Please join me in celebrating the incredible career and contributions of Dr. Chen.
Thank you, everyone. I won't keep you long. I just want to say that I really appreciate this incredible honor. Thank you to those who contributed to the award. Thank you to those who co-chaired the awards committee. And also, I'm so glad that I could accept this award at NERD for my PhD supervisor, Geoff Norman. Thank you for your mentorship, your support, and your guidance throughout all these years. It's nice to see you too. Thank you.
Before you go, the incredible day that we've had, the facilities, the logistics, all went seamlessly with no thought or contribution from Lawrence or myself. I want us to give a really significant thanks and recognition to our organizing committee, Samantha, Courtney, Sanina, Mel, but also to recognize Mark and Amy from MERIT and the whole crew. I want to thank all the moderators. I want to thank you as presenters. If this was your first time presenting, you felt your heart rate going high. I hope you felt that you were in a community, in a space where people were engaged with your research and supportive of that. I'd invite feedback on Nerd Day. We will debrief and we'll take your comments seriously in a way to improve the experience for you next year. If you fill out your feedback, there's a chance for you to win something great. I don't know too much what it is. We will take your name tags back. We have a parting gift for you, the Teacher's Toolkit, which is a number of free open access educational resources. Scan the QR code in front of you and see what resource that you might want to incorporate into your own education practice. I really hope to see you again next year, perhaps as a presenter, perhaps as a facilitator, but certainly as part of this community advancing education and education scholarship here in the faculty.